So a few years ago, I was treating a young patient who was a regular patient of mine, and she presented with a dental infection. She was a little bit red over her cheek, which is not surprising because she's 5 and she had a sore tooth. So we thought that she'd just rubbed it. But actually what that was signs that the infection was spreading to the tissues, and she did end up in hospital for about a week while they were trying to deal with her ongoing infection, even though the tooth had been removed. So when we are looking at signs and symptoms of sepsis in dental patients, ideally what we would like to see once you've had your dental treatment is that you'll start to feel better. If you find that once you've had a tooth out or that infection has hopefully been removed, you're still feeling quite unwell, getting flu-like symptoms, or finding that you're getting kind of a flushed area over where you have the pain and the problems, then it's always worth just sort of keeping in your mind that could this be sepsis and looking for some emergency help.